leads to the next question that is about, it's just a skin problem. Maybe Karen wants to speak about
Yeah.
the impact that that hives has on people more than just the overt manifestations of hives and
Yeah. Absolutely. And I think it is well recognized that chronic urticaria is more than skin deep. So certainly it involves physical manifestations, much like we have already discussed. But it's also important to recognize that it will often affect the mental well-being of the patient. And debilitating is a good word, Dr. Bernstein, that these patients are often rightfully so, quite distressed. And so we can see how the emotional aspect could confound the diagnosis. And what we do know is that outside of the symptoms that we most readily think of, the itching, the pain, the visible hives, things such as tiredness, sleep disturbance, achy muscles, achy joints, anxiety, even depression are well recognized with patients who have chronic urticaria. So I think the first thing for us to do is just to say, hey, it's okay to have some emotionals up and down with this condition. And that is something certainly to discuss with your doctor, your nurse practitioner, your physician assistant, who's ever following you, and to get some ideas. Part of our mission here, as Kristen so eloquently stated at the beginning, is really to provide resources that you can help support. We've mentioned several times how stress can be a mitigating factor for chronic urticaria in some patients. Well, you can see that if you've got stress just because of the disease, was the initial stress related to the job? I mean, it just gets quite murky. So I think what we can do is certainly advocate for emotional health and recognition that it's okay to be anxious about this. Talk about it. If you perhaps a counselor, you'll find it interesting is a very popular counseling approach is called cognitive behavioral therapy, CBT. It's big in the literature. It's quite mainstream as far as its availability. But this is one approach that counselors can use, psychologists can use, that has shown evidence, medical evidence, that patients with skin-related anxiety have improved outcomes. So you don't need to suffer in silence is really what I'm getting at. So
right.
yes.
So I use CBT for different things, but I think the best treatment for hives is make sure they get rid of them, just so they don't come back. And
Without
that really improves their
question.
quality of life. And as you know, in all of our clinical trials, we always measure a secondary endpoint, quality of life. And it's
Yeah.
very clear that
Yes.
the quality of life, which has effects on work, on school, on leisure activities, is significantly impaired. And when you treat them with different combinations of therapy, this quality of life significantly improves. In fact, I want to be clear that hives is not a psychiatric illness. It's a real problem, but it has secondary effects
Right.
on individuals' well-being. So, and if you have a difficult case and it's not responsive just to antihistamines, then you certainly need to see a specialist like an allergist or a dermatologist who has knowledge and experience with the treatment of hives so they can get you better controlled quickly and minimize this impairment.